Hey everyone, Gary with Tennessee Stands. All right, so I have an update for you. This is going to be long. It's going to be detailed. I know some of you want to scroll through, right? And you want to be done in about 45 seconds, maybe less. But you need to listen to everything I'm about to tell you, and you need to really, really wait to the end. All right? So we have the final bill. The Omnibus Bill, HB 9077 and SB 9014 has passed. It is now heading to the governor's desk to become law. Whether or not he signs it, it's going to become law, and it's going to become law effective immediately in a few days. As soon as the governor signs it, if he doesn't sign it, I think constitutionally it's 10 days. Some amount of days, I could be wrong. I don't remember how many days, but the point is, it's signed by our legislature. This is law. So we're going to go through the details of who gets a vaccine, who doesn't, who's exempt, who's not, and go through some things that happened in the middle of this conference committee. By the way, that was going on, like, I'm talking 1, 2 o'clock in the morning. I know some legislators didn't even get home until after 3 o'clock in the morning. So it was in the wee hours of the morning. So I'll tell you what, let's jump into it, right? Because you've been waiting for this. So essentially, what one of the biggest things to get here is this governmental entity definition, because this shows you who is exempt and how they're exempt from vaccine requirements. And a lot of it lays into the definition of what is a governmental entity. So a governmental entity does not include, per their definition, a medical provider, so a hospital, some sort of medical facility that has to abide by Medicare and Medicaid guidelines if Medicare and Medicaid requires employees, patients, whatever the case may be, makes a requirement for vaccination. Then that facility is exempt from these rules and would have to follow the guidelines in order to continue to receive their Medicaid and Medicare provider status. So that's sort of a federal opt-out, right? These facilities have to follow Medicare guidance. Also, does not include federal employees or federal property. Also, let me just tell you the list. I'll make it simpler because you don't want to read through all that legalese. Essentially, you can still be mandated to have a vaccine if you are emergency services personnel, ambulance workers, you EMTs, EMS, guys on the street helping you every day. You can be forcibly vaccinated. Hospital personnel, employees, contractors, students, and volunteers of healthcare providers, including schools affiliated with teaching or training hospitals. So if you're a nursing student, if you're in a medical program at even a public university that would require you to do rounds in a hospital. So just like the law already states, and Medicare. So these exemptions all hinge around Medicare. If the federal Medicare, Medicaid program requires those facilities to mandate the shots, you're no longer protected under Tennessee law. Assisted living, nursing home, and hospice. All of you workers, you can be mandated to have the shot. If you work under the airport authority, you can still be mandated to have the shot. And of course, all federal employees. And here's the other kicker. There are no provisions for medical or religious exemptions in state law. So if these entities want to require you or are forced federally to require you to have the shot, there is no state-secured opportunity for you to have religious exemptions or medical exemptions. Again, I guess in these cases, that would rely upon the federal government. But let's keep going. One thing about, so we're going to face coverings now. All right, so now we're dealing with masks. All right, so look, to clarify on the vaccine front, and we haven't gotten to the end of the bill that has the larger exemption, federal exemption. But in terms of vaccination status or vaccine requirements, fact is the law that did pass, the good part is that it's going to protect most employees. So no government entity, including private employers, cannot require that you show proof of having had a vaccine for COVID-19. They can also not take any adverse effects against you. They cannot treat you differently. They cannot deny you access or privileges that all other employees enjoy. They can in no way, shape, or form require you to have this vaccine. So that's going to protect a lot of people. Like I said, though, except for a lot of healthcare related instances, if and only if Medicare and Medicaid make a requirement, which I haven't looked that up. I'm not sure if that exists yet or not. I actually don't think it does, but I'm not sure. Don't quote me on that. All right, so let's move on to masks. Initially, the law would have banned, at least in the House version of the bill, all private entities from requiring the use of masks, which I thought was pretty awesome. That has gone away. Now, a government entity, including a school, which they have that separate. I'll get to that in a minute. But a government entity, so no, a mayor, a political subdivision, a county board of health, i.e., Shelby County, not a board of health, but your health department, but any state agency cannot require the use of a mask for COVID-19 unless there are two conditions. And this law calls them severe conditions. And severe conditions are defined by two things must exist. One, we must be in a state of emergency. We have to be in a legally declared state of emergency, which, by the way, we are in a declared state of emergency still in the state of Tennessee. But secondly, the other thing that must exist is that, let me get to my notes here. There must be a rolling 14-day average of infection rate of 1,000 per 100,000 county residents. So if we're in an emergency and if our COVID infection rate in your county is 1,000 per 100,000 county residents, then the government then may require masks to be worn. Those requirements can only last for 14 days, but they can be renewed every 14 days as long as those two conditions still exist. But outside of an emergency and outside of that high infection rate, those government entities cannot make those mandates. However, worth noting that if a government entity does make a mask mandate, this section here, law requires that they allow both a medical exemption and a religious exemption. All right. So we're in the height of COVID and it's emergency and everything's just crazy and they're mandating masks on everybody. And they make a mandate. They have to allow for medical exemptions and religious exemptions. So that's in there. All right. But here's the deal on masks, though. That's where we are on masks in terms of government entities. But here's something to be clear on. At this point in this new law, all private businesses, including healthcare and private schools, all right, because we're going to get to public schools in a minute. We fixed that. But if you're in a private school, because they consider a private school a private business, okay, including all healthcare facilities, may require masks for both employees and consumers, and no medical or religious exemptions are required by state law. All right. So if you're excited, we're banning masks in schools. Not if you're in a private school, not if they want to mandate masks. Take your money and go elsewhere, because they can require masks and they do not have to give you a religious or a medical exemption. All right. Last quick thing. Let me take you back here because there's one more thing I forgot to show you on the vaccines. You're going to love this. Two really important things to point out right here. So in section 14-2-102, COVID-19 vaccine status, subsection B, allowing a person to voluntarily provide proof of vaccination or proof of COVID-19 antibodies instead of a negative COVID-19 test in order to gain admission to a place of entertainment, that's the key part, is not a violation of this subsection. Let me translate that what that means for you. we're going to allow vaccine passports here in the state of Tennessee for entertainment venues. So if Bridgestone Arena wants to hold a concert, the Ryman wants to hold a concert, Tennessee Titans game, any entertainment venue here in the state of Tennessee, they can continue to require the use of vaccine passports. Now, they can't necessarily require that you have, let me read that again. Yeah, so as far as vaccination status, you have to voluntarily provide the proof of vaccination, but you would need to do that if you wanted to avoid the proof of a negative test, which is part of the vaccine passport system. You have to show the venue that you've either had the vaccine or you've tested negative for COVID. All right. So we are, for entertainment venues, this bill did not fix that. We are going to continue to allow. And I heard the debate on the floor about this. The debate was, well, we got to protect these concert businesses because they want to mandate vaccines and they want to make sure everybody's safe. So we have to protect those businesses because when you buy a ticket to go to a concert, it's like signing a contract. I really disagree. I don't see how buying a ticket to get the service of a concert is different from me walking into Kroger and buying a loaf of bread and going to the register and paying for it and taking my loaf of bread home. I gave you money. You gave me a service. You gave me a product. You gave me a good. The ticket is just a delayed enjoyment of the good that I have paid to receive of the service. So I don't get the whole contract bit that they were trying to pitch there, but what they did was they preserved the right. And look, I think this is dangerous. This is Tennessee. So entertainment is at the core of our industry, of our economy here in Tennessee. Unfortunately, the way they see it is that allowing these people to use vaccine passports is going to be good for the economy because they would all pull out if we told them they couldn't. That's the theory. But anyway, just so you know, that's in there. Let's keep going. What else? All right, so that pretty much deals with masks and vaccines. Again, I'll get to the big exemption here in just a minute because there's a few other things to get to. Also worth noting on the mask piece, I'm going to tell you very bluntly and frankly why now your private employers can mandate the masks and you have no religious exemption or whatever, unless your employer wants to give you one, but they're not required to by law. You have the Ford Motor Company to thank for that. You have the Ford Motor Company to thank. You have the Tennessee Business Roundtable. You have the Tennessee Chamber and all of their corporate CEOs, muckety mucks, that while this thing was in deliberation, they got organized, made phone calls, and scared all these folks into taking out these mask provisions that provide you the opportunity to go to work and breathe fresh air. Thank you, Ford. Welcome to Tennessee. All right. We did get a few things that I'm happy about, sort of, because I'm going to get to the really bad stuff in just a minute. So bear with me because there's some good things in here, but it's about to get real ugly. All right, schools. Yeah. Oh, sorry, I'm not done with math. Schools. There's a specific provision now for public schools whereby, as the public school system, the local school board in general cannot make a rule making a mask mandate over the school district. So they can't do that. However, if the principal of one school in the district submits a written request to the school board, that school board can allow that one school to mandate masks. Again, only if severe conditions exist. So we have to be in an emergency and we have to have that 1,000 per 100,000 infection rate. And the school board is going to be voting to require masks in that one school only. So it's a school by school basis. So that's what's in the law. A singular school can require masks, even a public school. However, the only saving grace there is, let me go back there. Here in subsection C, it does allow, they're required to accept medical exemptions and religious exemptions. So even if there's one school that does require mask mandate and you just so happen to be at that amazing school serving under that awesome principal, you still have a medical exemption or a religious exemption. So that's masks in schools. Also, schools are now required to provide a reasonable accommodation per the ADA for students who want to wear masks. And by the way, if the student's a minor, it has to be the parent's request, not the student's request. The parent must want them to wear a mask. And if that's the case, the school has to provide an in-person learning environment for those students that allow them to be distanced by 6 feet and wear a face covering. I think this is wholly appropriate. This is actually what an accommodation looks like. We're turning this back around the right way. We had an idiot federal judge in Knox County that said in order to provide the disabled an accommodation that everyone else had to wear masks. And I wrote a commentary. If you read it, it's literally like the bubble boy. Remember the bubble boy from the 1980s? He had this severe immune deficiency sickness, and he had to stay in a bubble because anything in the air could make him deathly sick. Well, according to that federal judge's ruling for Knoxville schools, the way he sees the ADA is that everybody else belongs in a bubble. We all belong in bubbles so that the bubble boy can be bubbleless so that he never gets sick. And that's what's been going on in our schools with these mask mandates. This law actually fixes that, interprets the Americans with Disabilities Act in an appropriate way. And if someone needs a reasonable accommodation, then we have a mechanism to provide that to them. So that's what we've done now. So that is masks. Let me pull up a couple other the key provisions here. Unemployment benefits, that stayed in there. So if you at any point in the last few months, they didn't put a time limit on this, but if at any point in time you left your job, you lost your job because of a vaccine requirement, and you lost your job because you refused to take the vaccine, you get retroactive payment for unemployment. I'm not quite exactly sure how that's going to work yet, but it's in the law. And so they're covering unemployment benefits for those who were forced out of their jobs. Here's another good one especially in terms of schools. Quarantining. I don't agree with all of this in theory, but it's better than allowing all of these schools to decide on themselves to quarantine healthy children. All right, so this nips that in the bud, and here's what it does. Only the Commissioner of Health now has the ability to set quarantine guidelines. All right. So the counties can't do it. Local governments, schools, no one has the authority to do that anymore. Only the Commissioner of Health. And they can't quarantine healthy people. You can see the quarantine of a person must be lifted if the person receives a negative test for COVID. So they can't quarantine you if you're asymptomatic and you're testing negative, like what's happening now in the school. The issue I have with this is that the commissioner is now given the ability to not only quarantine people in schools, but to quarantine businesses, to shut down businesses because of health-related issues to COVID-19. The issue is that this statute does not require those severe conditions to exist. It's a problem because we don't have to be in a state of emergency. And there doesn't have to be this 1,000 per 100,000 population metric infection rate. The Commissioner of Health can determine COVID's bad right now for your business, and I'm shutting your business down. That makes me nervous. It should make all of you nervous when we have a law like that on the books. Keep going. Monoclonal antibodies. It protects the fact that doctors can prescribe monoclonal antibodies. I think it's going to open that up. I think that's good. All right, we dealt with the mature minor doctrine. Another good thing. A healthcare provider shall not provide a patient who is a minor with a COVID-19 vaccine without first obtaining written consent from the minor's parent or legal guardian. This is great. So, Shelley Fiscus, thank you. Thank you for letting us know that this issue existed. And bye, Felicia. Glad you're gone. Glad you left Tennessee. But thank you for alerting us that we had a problem. And now we fixed it. So I'm excited about that. We have to have parental consent to give any child a vaccine for COVID. We should do more in terms of medical treatment, but we fixed the COVID piece for now. All right, this is a big one. I told you last night or yesterday about the medical boards. This changed a little bit in the wee hours of the morning. It's not as strong as it was, but there's still an additional level of protection. Right now, there was a rule promulgated by the Medical Examiners Board, who regulates the licenses of medical practitioners, to keep medical doctors from issuing misinformation, which means they want to give you ivermectin. So we're gonna punish them and take their license. Okay, are telling you that maybe the vaccine isn't a vaccine, and we're gonna take their license. What this law does now is, if the medical board wants to make additional rules like that to put medical licenses under that greater level of scrutiny, then they must bring that rule before the Government Operations Committee of the legislature. In other words, if they want to start issuing rules like that over physicians and disciplining them in those ways, that action has to first be passed into the rules by the legislature, by the GovOps Committee. And I will tell you, as far as today goes, we have a wonderful Government Operations Committee. So I feel like right now that law keeps us fairly safe. I really do. I don't know what the Government Operations Committee is going to be like in the next couple of years. So there's that. But anyway, at the very least, it puts the legislature in a position to protect these doctors from being discriminated against by our licensing authorities. So I think it's a good thing. Let's move on down. Here we go. Get into the meat and potatoes of this exemption here. All right. Good thing this has been in the bill, the state in the bill. Should the federal government decide that we've got to make all these COVID-19 mitigation efforts and whatever, the state is not allowed to allocate state funds to enforce those federal regulations. And the federal government cannot commandeer personnel or property of this state in order to enforce those federal regulations for COVID-19. So I think those are good things. But here is the federal exemption. All right. And it exempts these entities from Chapter 2 or Chapter 6, which this is Chapter 6, and Chapter 2 is all of the vaccine and masking stuff. So primarily what we're concerned here is the vaccine, because we're saying these government entities and private entities can't require the vaccine. All right. Unfortunately, here's what we're saying now. If a business, for example, a federal contractor like the Oak Ridge National Laboratory, that's one of the big ones. All right. So it's all these massive hundreds of millions of dollars federal contracts at these national laboratories and things like that in Oak Ridge. If the federal government puts a requirement on them that the funding that they get through their contract is threatened by this state law, they can apply to the comptroller of this state, and the comptroller of the state of Tennessee now can give those entities an exemption from this entire law. And so should the federal government ever make those requirements on these federal contractors, all of those employees now have no protection from the state of Tennessee. I'm going to say this in the most gracious way I can. This part of the bill and the fact that it's in here is a travesty to me, because what we're saying is we are abdicating states' rights to the federal government. Those employees that work in those facilities that work as federal contractors are still Tennessee citizens. And those Tennessee citizens should be afforded by equal protection, honestly. There's a part of me that believes that this law is actually unconstitutional per the 14th Amendment, because we've separated them from the rest of the Tennessee population in such a way that I don't think is distinct enough to treat them any differently than any other Tennessean. So what we're saying to these thousands of Tennesseans is, if you work for one of these federal contractors and the federal government wants to make you have a vaccine, then Tennessee law does not apply. Wow. That's incredible, isn't it? We're literally telling a group of Tennesseans that this portion of Tennessee law does not apply to you. We do not protect you. We do not protect your individual liberties. Let me go up here and read this for a minute. This is actually really critical. Read this section of the bill right here. Broad construction to safeguard liberty. Let me read this to you. The purpose of this title is to safeguard the constitutional rights and liberty interests of persons during the COVID-19 pandemic. This title must be construed broadly to effectuate the purpose described in this section. So we're saying we are safeguarding the constitutional rights and liberty interest of persons. Okay, but we're saying down here, though, however, if those persons fall within this category, then we no longer protect your constitutional rights and liberties anymore as a state. Your constitutional liberties and rights are not protected by this state anymore if you fall into these categories. I'm telling you that the purpose of this law should have been to clearly draw a line in the sand and a distinction and almost force a fight between Tennessee and the federal government. This bill, because of this exemption, does not do that. And we did it all for federal dollars. Let me keep going because I'm going to get to a part that's even worse. One thing that I do appreciate about this bill is you do have a cause of action. If anyone violates this law and unlawfully forces you to take a vaccine as a condition of employment or any of these other instances, you have a right to sue for damages, injunctive relief, and attorney's fees. So that's good. But before we read, I'll show you this last part. Let me set this up for you, and I'm going to close here. I know I'm almost 30 minutes in, but bear with me because I'm closing, and this is going to be one of the most important things I'm about to tell you. There was no reason to rush this. You're going to hear from the General Assembly that we did the best we can, and look all the things we got done, and we got it done in 2.5 days. And I agree with them, actually. They got a tremendous amount done in this bill in 2.5 days. More, I had some legislators say, well, this is more than I thought we would get. I'm going to be honest. In some ways, in 2.5 days, I almost kind of agree. As hard as this fight have been, that doesn't mean it's good enough. It doesn't mean that that we should accept that. But it is where we are right now in our General Assembly. But the bigger point I want to make is that this did not have to be a 2.5-day session. It was supposed to be a 2-week. I had some people say, I think this might go 3 weeks. The reason they were there till 2 or 3 o'clock this morning, they did that to themselves. They put themselves in this position and they rushed this process, and this is what we came out with. It's not the other way around. They weren't put in this position. They put themselves in this position. Okay. So I just want to make that needs to be clear before you hear all of this going around. But here's what happened in the wee hours of the morning. And I want to give a little bit of grace here with what I'm about to say, because it's going to be strong, and you're going to be pretty pissed off here in just a minute whenever I show you what was slid in here to this law. I promise you will. So keep watching. I'm almost there. I want to get there. There are a lot of legislators in the House and the Senate that disagree with this bill and felt they had no other option than to pass this bill because of the powers that be. And they truly wanted to get something on the books. We can protect as many Tennesseans as we can from this vaccine, and we can get masks off of our kids in schools. We can protect our doctors. All of these really good things that I think they wanted to do. They should have done more. They shouldn't have rushed through this. But I want to say this because I guarantee you what I'm about to show you. Most of those legislators had no idea that this was in there. And the first time that they saw it, I went back and looked at my records. The first time that they saw it was about at 1 o'clock this morning when they were asked to vote on this bill. With all of the changes and everything they were having to consider, they're all worn out. They're tired. I mean, some of these legislators are, 60 plus, 70 plus. I mean, it's a long day for a guy in his 40s. I left before they were finished. So it's a long day for anybody. When they went to vote on this bill, here's what they saw for the first time that I bet many of them did not see. Right here. See where it says this title? Except for Chapter 5, because that's the liability piece that already expires on July 1st, 2022. But this entire title, all of this protection, everything that I just read to you, every single thing that I just read to you is set to terminate on July 1st, 2023. That was not in the bill before. I went look at them. The House bill and the Senate bill that passed earlier in the day that I told you about, that termination date was not in those bills. The first time that termination date ever showed up was this morning, early this morning. Now let me show you why this is incredibly concerning. You remember last year when earlier this year when we passed SB 187. We went to the Capitol, 400 strong. We went into committee. We passed SB 187, and we passed a law that said this state, no government agency, school, county, mayor, no state agency can mandate a shot for COVID-19 ever. It was permanent. It sat in Title 68. It was in law permanently, enshrined in law. This shot can never be mandated. Okay? That law that passed sat right here in Title 68, 5, 115, 116, and 117. And it was permanent. This bill that we just passed deleted those sections of the code. Let me say that again. The permanent protections that we passed earlier this year for the COVID-19 shot, by passing this bill in Title 14, was deleted out of that code. And it now all sits in Title 14, which means that on July 1st, 2023, there is no longer a law in the state of Tennessee that prevents a state, a school, or anyone else from mandating this shot. That means currently, according to this law, after that date in 2023, when the COVID shot is wherever it's going to be at that point, fully approved, they now can legally make this shot a schedule on the vaccine schedule for your child and in our schools. Thanks to passing this bill and adding that termination date in the wee hours of the morning for the very first time. It had never been in the bill before. And it's the medical lobbyists that put that in there. It's the Tennessee Medical Association, the Tennessee Hospital Association, all those wonderful attorneys for the hospital associations that are just there for your benefit and to keep you safe. This is what passed. I'm disappointed on so many levels with the fact that we have just now taken away permanently our protections from this COVID-19 shot that we fought so hard for to get earlier this year. They're now gone until 2023. They're gone. They're here until 2023. And so many people in the state of Tennessee that we chose are not deserving, not worthy of protection under our Constitution and the rights and privileges afforded to them under the laws of this state. We shirked them off to the federal government. That's all I got for now. That is the best update I can give you. This is now heading to the governor's desk. This is going to be law in the state of Tennessee. And I'm disheartened by much of it. I'm glad that it's going to provide some protection for a lot of people right now in the immediate. It will. But in terms of the federal government and the permanent protections that we've let go, I'm greatly saddened by that. Thank you for your prayers. Thank you for continuing to fight. Thank you for following Tennessee Stands. We love you. God bless you.